Gabriel, can you hear me? I think you may be on mute if you're talking. Okay, I think everybody's on mute and has their camera off except for me. So can you let me know if you can hear me or not? Isabel, I can see your lips moving, but you need to turn on your microphone.
Hello.
There you go. Good.
That's all.
Thank you. Okay, Jay, I can see you. Hi. Does anybody know how many we plan, we think may be showing up? I'll take that as a no. Okay. We'll give them just a couple more minutes here. Okay, well, let's go ahead and get started. This is going to be interactive. So it's going to be real quiet. Let me turn on, actually close my blinds here. It's going to be real quiet if we don't, people don't come off their, come off mute. Okay, so it can be interactive. Let's have everybody turn on their microphone. I don't think I can do that from my end. If you don't know how to do that, I'm sure you do. You've been on enough probably virtual classes in the past year. Okay, still got a couple that are muted, but we'll go ahead and get started. So what I thought we would do is go over the basic form of the kind of questions you're going to see on the test. Talk about those. We'll go through some images here, but we'll also talk about the kind of questions that I know you'll see there, and there's some repeating kind of questions that you can anticipate, and it's just a matter of numbers. So how many glands you're asked to name, how many hormones from a particular gland. I don't see any questions where you're asked to name all of the hormones that are secreted from the anterior pituitary. So you're usually asked to contribute one or two. So I think that's key. You should know at least one or two hormones that come out of every one of these glands. Likewise, one chain of hormone, releasing hormones, stimulating hormones, and their targets. So I think based on the quiz, one thing that everybody got tripped up on is carefully looking at what the question says. Does the question say to secrete? Does it say what's a target of a particular hormone? And a lot of people miss those questions because they were asked for a target and they were giving actually the product of that particular gland. So pay close attention to that. You're liable to see more of those kind of tests. Although from what I could see on the exam, most of the questions are very straightforward. This time around, there's less of those kinds of questions. So let's start off with kind of basics here on the endocrine system. Let's name 6 endocrine glands.
Hypothalamus.
Hypothalamus. Okay, who's got another one?
Pineal.
I'm sorry?
Pineal.
Okay.
Thyroid.
Thyroid.
The pituitary.
Pituitary. There's some nuances there. Can you define that a little better?
The anterior and posterior.
Yeah, really 2 different glands. So,
Okay.
yep. Another one?
Adrenal gland.
Adrenal, I think that was mentioned. How about the different parts of the adrenal? Can somebody, just the two main portions of the adrenal gland?
The medulla and the cortex.
Right. Okay. One more.
Did someone say ovaries?
I don't believe so. But those haven't been showing up on the test. I think those are going to be saved for when we do the reproductive system. So,
Did anyone say the pancreas?
no,
Okay.
that's the other one. So, also endocrine and exocrine. All right. So let's take each one of those and somebody give me a hormone that's secreted by each one of those. Hypothalamus first.
Well, the hypothalamus is going to be any of your inhibiting or stimulating hormones. So I guess growth hormone, inhibiting hormone,
Look out. It's not stimulating, it's releasing.
releasing. I literally missed that on the quiz.
You did. Everybody missed that. Okay.
So
So that's what I'm trying to save you all from here. It's those little things that trip you up. So there's trophic hormones, the releasing hormones, and every one of those, if you look, they're all TRH, CRH, GnRH, GHRH. They're all releasing. So be careful there and make sure you've got releasing in any of the hypothalamic hormones that are stimulating the anterior pituitary. Okay, so thyroid releasing hormone or thyrotropic, gonadotropic releasing hormone, growth hormone releasing hormone, and corticotropin releasing hormone, CRH. Okay. What two hormones are secreted in the hypothalamus but released in the pituitary?
Growth hormone? No.
Nope. Almost everybody missed this one too on the quiz.
Oxytocin is one.
Oxytocin, yep. And what's the other one? Similar releasing location.
and antidiuretic.
Antidiuretic hormone, correct. So both of those are secreted in the hypothalamus and then released in the posterior pituitary. They're what? What do we call those?
What do we call the hormones?
What type of hormones are those? Or part of another definition of that portion in the posterior pituitary hypothalamic relationship there. They're being released by a nerve, not through the vein, the portal system, but through the nerve that then runs down into the posterior pituitary. What would you call that?
Isn't that just neuroendocrine?
Neuroendocrine. Yeah. So that's why when you look at the posterior pituitary, you don't see glandular type cells or structures. You see nervous tissue. All right. So remember those two because they're unique. Let's see. Okay. How about the thyroid? Who can name two hormones that are released by the thyroid?
Pyroxin and
T3 and T4.
T3, T4. Can anybody name a third hormone?
Calcitonin.
I'm sorry?
Calcitonin.
Calcitonin. Yep. Good. Okay. What's calcitonin do? Somebody else can answer too. Some of those with your microphones off. You're welcome to jump in here anytime you want.
stimulates bone deposition.
Might have something to do with California. No. How about calcium?
It lowers the level of calcium in the bloodstream.
Lowers the level of calcium. That's right. How does it do that? It drives it into the bone, stimulates osteoblasts. All right. What raises calcium?
Is that parathyroid hormone?
Parathyroid hormone. Where does that come from?
Parathyroid.
Very good. All right. Does anybody know, we didn't talk much about this, but the thymus, what's characteristic about the thymus in the adult? Not necessarily what it does, but what happens to the thymus?
Isn't it like smaller? I think.
Yes, it atrophies. So it really just shrinks down, has very minimal function in the adult. It's quite large in an infant. That's the main thing to know about the thymus. All right. So the other thing that you're going to be asked to name, and before we just pull up images of those here in a little bit, it's good to just kind of go through them in your mind. And that is 4 chambers, 4 valves, and the vessels. So you can name the 4 main chambers of the heart. Somebody give me one.
Right atrium.
Right atrium. Somebody give me another one. Somebody else give me another
Left atrium.
one. Left atrium. Okay.
Right ventricle.
Yep.
Ventricle.
Okay. Now, somebody tell me which valves connect those two. So right atrium and right ventricle. What's the valve?
Tricuspid.
Tricuspid. What's another name for that valve? Keep you from getting confused sometimes. It's maybe best to just go right atrioventricular, left atrioventricular. And those are certainly valid answers on the test, okay? How about, so we actually did left atrium, left ventricle. How about the pulmonary artery? Where does the blood come from that feeds the pulmonary artery?
The pulmonary vein, I think.
No. So I was surprised, almost everybody missed this. So a lot of people said that and I think I know why this is happening. Said the right pulmonary, or the pulmonary artery, is fed by the left ventricle. It can't. It's going to the lungs, right? That's part of the pulmonary circuit. But it's an artery, so that's deoxygenated blood. It doesn't. I know it doesn't make sense actually, unless you think about it. And blood coming from the lungs comes through what?
Pulmonary vein.
Pulmonary veins into the left atrium. The fact that those are called veins is confusing to a lot of people, I think. And so make sure you think through that pulmonary artery, right ventricle, pulmonary veins going to the left atrium, left ventricle, systemic circulation. So watch for that closely. I think people know that, but they respond too quickly and they're just thinking arteries, veins. So the coronary sinus empties into what?
Oh, right atrium.
Right atrium. It's a vein. It's returning the coronary circulation, goes into the right atrium. Because it has to be oxygenated, right, before it goes back to the heart. Okay, let's see here. We'll go through some different cell types here in a minute, but so I think if you read my note up there, there's going to be 30 identification questions. And so since I won't be there, the guy, Dr. Sadin, who has the class just before me, another class of BIO211, he will have marked everything. We've kind of talked about this, so we're kind of on the same page as far as tagging things. He will tag all of these pieces for you, and let me know that he's going to kind of split the tagging for example, for the heart between about half will be models, half will be on the cadavers. And most of the things that we've talked about marking, I think are going to be very straightforward. I don't think there'll be any surprises there. And he agrees that, you know, trying to find good structures in place is important to make it as obvious as possible what we're talking about. A lot of the internal structures will probably be marked on models because we just don't have good specimens. So think through those models that you've seen. Look at the diagrams, which are pretty close to the models in your book and elsewhere that define those common things that you can see. So chordae tendineae, papillary muscles connecting the valves. I don't think anybody would show a moderator band, but I think you all have seen that in the book or on the models. And then the different valves, basically. And just think about which side of the heart you're on in each location, and which thing is actually tagged, whether it's the valve, whether it's a chordae tendineae, exactly what the tag is on. And it's fair game to actually ask what the tag is hanging off of. Okay. All right. Now I'm jumping around a little bit because this is the way the questions will be. So back to pancreas. Somebody give me 2 hormones that are released by the pancreas.
Insulin and glucagon.
Yep. Very good. And I haven't seen any question that asks for more than 2 hormones from any particular gland or site. So let's see. What are the zones in the pancreas from which insulin is released?
Did the islets of Langerhans cells?
Islets of Langerhans.
Sorry.
Yeah. And the cells are a good question though. What are the cells? There's alpha cells and beta cells. Which ones release insulin?
Beta cells.
Beta cells, right. And so those islets that you see, those little pockets, if you're asked what those cells are, those will always be beta cells. The alpha cells release glucagon. Okay. You probably won't be asked to identify them because they're not easily identified or separated from the others. But okay. The adrenal cortex. So how many zones are in the adrenal cortex?
4.
No.
3 zones.
I could make that work, but no. There's an outer capsule, and then there's 3 zones. Okay. Anybody know the names of those? from the outside in.
Zona glomerulosa.
Fasciculata and reticularis.
Reticularis, that's right. Can somebody name one hormone that's secreted by each of those zones, starting with glomerulosa?
Isn't
the
it?
glomerul-
You got it. Isn't it mineral corticoids,
Yes.
glucocorticoids, and gonad corticoids?
Close. Androgens is usually what we refer to those as, but and I think the book describes it that way. You can actually get androgens and glucocorticoids out of the reticularis and fasciculata, both. So, but mineralocorticoids or aldosterone would also be a reasonable answer for the glomerulosa. Okay. And then the medulla releases what?
Epinephrine, norepinephrine, and dopamine.
Correct. Yep. And it's stimulated by what?
Adrenocorticotropic hormone.
No, in the name, you know that's not right. Adrenocorticotropic. So that's the adrenal cortex. So that would be stimulating glucocorticoids. So this is another neuroendocrine connection. So it's a sympathetic nervous system. So we know that epinephrine, adrenaline, right, is part of the sympathetic nervous system. It is the flight or fright hormone. And so it's your sympathetic nervous system that I think you all went through this in the nervous system probably in 210. But here's a good way to think of the sympathetic nervous system. That's when you're being chased by a zombie, okay? That releases those kinds of hormones. Think of an old man after a big meal, and that's your parasympathetic nervous system. So where everything starts to drop off, heart rate, drowsiness, everything is turned down with the parasympathetic nervous system, sympathetic nervous system, flight or fright. And that's epinephrine, norepinephrine, dopamine. Okay. All right. So the other 20 questions are going to be didactic kind of questions. So they're, what tissue does this hormone target? What hormone does this gland release? What valve is between these two chambers, et cetera, et cetera. So let's see here. What's the target of antidiuretic hormone?
Kidneys?
Sorry? Did somebody say something?
Kidneys.
Yeah.
Kidney, did you say? I can't hear you. I'm sorry. You have to speak up, or I'll turn my volume up or something.
I said kidneys, but I'm not sure.
Kidney, that's correct. How about ACTH? We just talked about it.
Adrenal cortex.
Adrenal cortex, right. And what does it stimulate?
Cortisol.
Yeah. Yeah, that's one of the things and that's good enough. Let's see. Give me somebody give me two hormones released by the anterior pituitary.
Prolactin and growth hormone.
Yep, that's two. Can somebody give me two more?
Luteinizing hormone and thyroid stimulating hormone.
Thyroid stimulating, and what was the other one you said?
Luteinizing? Am I saying that right? Luteinizing hormone?
Oh, luteinizing hormone. Yes, yes. And there's 6 of them all together. Haven't mentioned the most common one you think about yet. Or did you said thyroid stimulating hormone?
Yes.
Yeah, okay. So there's 2 more.
Follicle stimulating hormone.
Yes. And one more.
Adrenocorticotropic hormone.
Yes. Yep. Good. All right. What do platelets do? What's the function of a platelet?
Don't they clot blood?
They do. Right. Another right answer would be hemostasis or stopping bleeding. Okay. So they're critical to that. And somebody had a very clever answer. There was a question, which cell does not have a nucleus in the blood?
Red blood cell?
Red blood cell. Yeah, that's the obvious answer. The red blood cells actually have the nucleus ejected as they're being formed toward the end when they're being formed. But somebody on the quiz put down platelets. That's actually true if they were considered a cell. I don't think platelets are actually considered cell. They are chunks that are broken off a giant cell in the bone marrow called the megakaryocyte. So that was a good guess, though. I was creativity was good there, but that would be wrong. So platelets, really coordinate the blood clotting and also help in the dissolution of clots ultimately. And that's all the detail that I think you're going to have to know for this test about platelets. How about red blood cells? Somebody tell me what they do.
They transport respiratory gases.
Mm-hmm. And what would those be?
Oxygen and carbon dioxide.
That's right. And how do they do that? What's in a red blood cell that helps it do that?
Hemoglobin.
Hemoglobin, correct. What do white blood cells do?
Fight infections.
Mm-hmm. They do a lot of things actually, but that's at the top of the list. Another question I've seen repeatedly on all these exams are the 3 functions of blood, which is very high level, but you probably count on it being on there. Somebody give me 2 of the functions of blood.
Transports nutrients.
Yes. Yep. And
Transports hormones.
that would be in the same category. Transports things. Okay, moves things around the body. Yeah. And there was another one.
It regulates like levels within the body, like pH and temperature.
Correct. Yeah. And then because it carries around white blood cells, there's something else that it does.
Fights infection.
Protection is the term they're looking for. But so yeah, it protects us by really distributing the immune system. So okay. Let's see here. All right, let me pull up some images here, and we'll go through some of these. Let me share my screen. Actually. Let's see here. All right. Can you all see my? Let's see which one I want to put up there. I'm not sure which screen you guys are seeing. What do you see up there right now? Or do you see me?
A join Zoom scene.
What's that?
Join Zoom live demo.
Oh, okay. So it's still the center. All right. So what is this top frame A up here showing? You got a nerve cell here and some other cells down here that look like they're secreting something. We talked about this earlier, related to the posterior pituitary.
So it's a neuroendocrine reaction?
Yes. Yep. Neuroendocrine. So again, ADH, oxytocin secreted in the hypothalamus, transported down the axon, and released from the posterior pituitary. How about B down here? What is this these two capillary beds that are connected together here called?
A portal system?
Right. Hypothalamic pituitary portal system. So you have this capillary bed in the hypothalamus. It picks up the releasing hormones, sends them to the anterior pituitary where it releases the stimulating hormones, right?
If we called it the hypophyseal portal, would that be okay also?
Yeah. So I don't think you're going to be asked any of these neural centers where these things are released from, but just appreciate that. Just another picture here of the posterior pituitary and the release. This is neuroendocrine. This is purely hormonal with hormones being released into the blood. Okay, on the anterior portion. All right. In the same way, now as you remember, one of the images in your histology packets there has cells that look like this, and it shows a big blob. The front part, or one part of it, the largest part of it, looks like this. These are glandular cells. That's what part of the pituitary?
The anterior.
Anterior pituitary. And this part in the back is then
Posterior.
posterior pituitary. And so this looks a little more like nerve tissue. Here again, part of the neuroendocrine system. Okay, so.
Sorry, I had a question.
Yeah.
So the main way to differentiate between posterior and anterior is that anterior is darker in color?
Is what again?
Is the anterior pituitary darker in color?
Yeah. It stains basophilic because these are secretory cells. And so they take up that basophilic dye. The nervous tissue, the only thing that takes out the basophilic dye are the nuclei of those cells. So it looks much lighter. Okay. All right. So who can tell me which hormone is targeting each of these glands? So what about the breast coming from the anterior pituitary?
Prolactin.
Prolactin, correct. About what's this gland? And what's the
Thyroid.
Yep. And what comes from the anterior pituitary that targets it?
Thyroid stimulating, I think.
Correct. Yep. How about, well, yeah, I guess that's fair. All the purple here. So the key is it's stimulating lots of different types of tissues.
Growth hormone.
Growth hormone, correct. And how about this thing? What is that, first of all?
Is that the adrenal gland?
That's the adrenal gland. Yep.
So adrenocorticotropic hormone.
That's right. ACTH. Correct. Where are you going to find the adrenal gland? They've got it tagged
Sorry, on top of the kidney.
on top of the kidney. Yeah. So look for the kidney. If there's it'll look kind of like a little purple kidney bean shaped thing. Well, a big kidney bean shaped thing. It looked like a little hunk of fat. We had a pretty good one on the last one, but it was kind of buried down behind the liver. And so a few people missed that. But look for a kidney. And it actually, in some cases, they call it the suprarenal gland, but more commonly it's known as the adrenal gland. We'll leave the gonads for right now, but that would be gonadotropic stimulating hormone. Okay, so what is this describing here? Where you've got
Negative feedback.
negative feedback loop. That's right. So what is being turned off here in the hypothalamus and the anterior pituitary?
Is it the thyroid stimulating hormone?
Yes. From the anterior pituitary, correct? And TRH from the hypothalamus, right? Thyroid releasing hormone. Thyrotropin releasing hormone. Okay. So what are these pink things here?
Follicles.
What's that?
Are those the follicles?
Yes, yeah, thyroid follicles. Yeah, we're talking about a thyroid gland here. So those are follicles. So what are the cells lining that?
Follicular cells.
Parafollicular. Or no, you know what? I think you're right. They are follicular cells. Yes. So they actually secrete this thyroglobulin. And then what are these clear looking cells here? I just called them actually. Those are
Parafollicular cells.
parafollicular cells, right? They're also called C cells, or which stands for clear cells. And you know what they secrete?
Is it calcitonin?
Yeah. Yep. Very good.
So what's the difference between parafollicular cells and follicular cells
So
in looks?
parafollicular are these ones right around the outside of the follicle. So they actually end up secreting the thyroid hormone. I've got an illustration here. I think if I kept that, I may have dumped it. Oh no, here it is. So there are these cells that are right around the outside of the thyroid follicle, and they secrete this this thyroid globulin, and then they combine it. They take in iodine and combine it with iodine, and make thyroid hormone and store it out here as thyroid globulin. Then when TSH stimulates the thyroid gland, it reabsorbs the thyroid globulin, which is an enormous protein. It's, I don't know, over 1,000 amino acids long, that breaks off a couple of the thyroid moieties and releases either T3 or, so some of these have just one iodine, some have two. And as they match up in the thyroid globulin, sometimes you end up with 4 iodine and sometimes 3. That's how you end up with T3 or T4. So that's the way the thyroid gland works and stores thyroid hormone. It actually has stored a tremendous volume of thyroid hormone all stored up there. It's the only place in the body where iodine is used. The only reason you need iodine in your diet. Okay, and then these little cells are release the calcitonin. They're the parafollicular cells. So if you think about this, and you're exactly right, while ago, the ones that are right around the follicle are the follicular cells. The ones that are in between the follicles are parafollicular. So it makes sense. Okay, got it? Any other good questions? Then what are these little nubbins here on the back of the thyroid?
Parathyroid.
Parathyroid. There you go. Okay, let's see. Let's move on here to, so we're obviously looking at the adrenal gland. Again, what is this layer up here? The top layer. I mean, we got the capsule, but just inside the capsule, what do you have?
Zona glomerulosa.
Zona glomerulosa, correct. What's it make?
Aldosterone.
Aldosterone, correct. Then what's the next level down?
Zona fasciculata.
Fasciculata, correct. And what's it make? Anybody?
It makes glucocorticoid.
Correct. And the next level down?
Zona reticularis.
Correct. Yep. And
And it makes androgens.
yes. Yep. Very good. So it's always hard to see what they're talking about, but you can kind of tell from this specimen. I don't think that our histology slides in the lab show this as well, but you have the little globule-looking structure supposedly in glomerulosa, the vertical bands perpendicular to the capsule in fasciculata, and then this kind of network-looking thing in the reticularis that should help define those, but if you just remember the order of them, outermost glomerulosa, fasciculata, and reticularis. And then what's in the center down here?
The medulla.
The medulla. And you know it because should have a dense capillary bed that's picking up the epinephrine, norepinephrine. Unlike other hormones, obviously it's made to respond very quickly. So stimulated by the sympathetic nerve, flight or fright, and immediately dumps epinephrine or adrenaline, norepinephrine into the capillaries and circulates throughout the whole body in just a matter of seconds. Okay. So let's looking at the pancreas. In some of our quizzes, we had quite a few questions about non-endocrine functions of the pancreas. I don't think you'll see any of that on this test. That should really be reserved for the GI. But when you see a densely glandular structure, so again, it's dark and dense with this, excuse me, basophilic coloring. And then these lighter portions as little globules out there, those are the islets of Langerhans. And that's where your insulin comes from. The alpha cells and beta cells, you're not going to be able to differentiate on those images, so I don't think you'll be asked to name those cells. But that's how you'll know what you're looking at if it has this speckled appearance with these other nodules in there. So I think those are really the only images you'll be asked to look at. It's a nice picture of a goiter, by the way. A first-year medical student could pick that up, but usually it's a little more subtle. But they can become quite dramatic. All right, let me get another set here. Here's some blood. So can anybody name these cells? Look like little cough drops.
Red
Erythrocyte.
blood cells. Oh,
Blood cells. Yeah, red blood cells are very consistent in size. You'll see that they're very uniform in dimension. They're 7 angstroms. They can actually be used to measure other things. They're so consistent in size and dimension, or 7 microns, I should say. The rest of these you could just classify as white cells, and I don't think you'll be asked. It doesn't seem like to differentiate anymore. One of these little speckle things in here.
Platelets.
Platelets, yep. Very good.
So are they going to ask us what is, if they're going to ask for the specific name for red blood cells would be erythrocytes, and then specific name for white blood cells, leukocytes?
Those are certainly acceptable answers. Yeah, and probably more descriptive or accurate, but RBCs, WBCs are acceptable answers also.
Okay, cool.
Yep. Okay, let's see. This is just showing about the red blood cell a little bit. And this is hemoglobin. I don't think you'll be asked any questions other than what hemoglobin carries. And you should know it carries both oxygen and CO2. Okay, so this is development of blood cells, and I'm not going to go into that. Anybody know what they're showing here?
Blood type
Platelets.
with it.
Yeah, they're blood typing. So this is agglutination, where you've got antibodies attaching to red blood cells, clumping them together because they're reacting to a particular antibody. So type A blood reacts with anti-A, right? Type B will react with anti-B. What's the universal donor type blood?
O
O what?
positive.
O negative, right? O negative. So what's the antigen called for the Rh factor? You got A, B, and
D.
D, correct. Yeah. And what is the universal recipient?
AB.
AB, correct. AB negative. All right. So I don't think you're going to have any questions about Rh factor in pregnancy, clotting, and these are different types of white blood cells. So I think that's pretty much it, what you need to know about the blood, or that you might be asked about. So that brings us back to our favorite, the heart here. So pulmonary systemic circulation is pretty basic. Anybody have any questions about that? Just always think right heart, pulmonary, left heart, systemic. And so what are they showing here? What is this thing? This thing
It's the
around.
ligament that holds the aorta and pulmonary trunk together.
Nope. It's this lining out here on the outside of the heart.
Pericardium.
Pericardium, right. So that part that's attached to the heart itself is the
Myocardium.
well, that is the myocardium, but the outside of the part of the pericardium that's attached to it is the
Visceral
pericardium, and then the outside
parietal.
parietal pericardium, right? Okay. You're just showing some pictures of the heart here, so everybody understands the left side of the heart is thicker than the right, and so we're looking at anterior. So I think becoming familiar with these vessels in their orientation, if they were nice red and blue blood vessels, everything would be easy, right? But they all look the same in the cadaver. Just realize if you can look at the end of any of these vessels, that's a good clue. The veins will always be thin and floppy for the most part. Pulmonary trunk's a little different because it's a big beefy vessel, but it's still much thinner than the aorta. Similar to the superior and inferior vena cava, which are also big veins. But look at those closely. We had a lot of people calling the pulmonary trunk the aorta the other day, and I can see how that can be confused sometimes. But try to look at the orientation and look for all the clues that you can get. So the aorta is going to very quickly have vessels coming off of it headed toward the head. So brachiocephalic and carotid and brachial arteries, but those won't be on the test, but those can be clues that you're looking at the aorta as compared to the pulmonary trunk, which is just going to have two big right and left pulmonary arteries coming off immediately, but they kind of dive in back behind the aorta when it's in place. This, of course, the backside of the heart. And there you can actually see the pulmonary arteries coming off right and left, aorta coming over the top, and then you realize that your left atrium, if they're trying to tag it, it's going to be directly behind the heart. So you really can't see it very well from the front. But if you see a little cluster of vessels that are tagged, sticking out like that, those are always going to be pulmonary veins. And so this is also kind of confusing because you got pulmonary veins coming in that are red. You got pulmonary artery coming out that's blue, but it's because of the oxygenation of the blood, obviously. But don't get those mixed up because I think some people have. Okay. It's just showing the orientation of the myocardium. And an unusual view here that's showing the aortic and pulmonary valves. And then tricuspid and bicuspid, which tricuspid is what? It's always the
Right atrial ventricular side.
That's right. Right atrioventricular and bicuspid or mitral. Most commonly in medicine it's called mitral valve, but bicuspid. Because of that, there's a condition known as mitral valve prolapse. It's very common that you can hear. You'll find it on just some asymptomatic people sometimes, and it's where these chordae tendineae are a little lax on the mitral valve, and so when it closes, it kind of snaps and balloons back into the left atrium, and it snaps or creates a clicking sound when the ventricle starts to contract, and that pressure snaps it closed, and it makes that kind of snapping noise like you would, snap a towel or something. Obviously not that loud, but those of you who go into medicine, listen to a lot of hearts, you'll hear that pretty soon. It's just showing the blood flow again. There will be several questions that relate to the blood is flowing from where to where, across what valve, from what chamber to which artery, from which atrium where, and just keep that blood flow in mind and think it through. Because I think every single person missed something on the blood flow and flowing from which ventricle to which artery, which vein, from which vein to which atrium, etc. So read those questions carefully. Let's let's see here. Just showing the coronary circulation. I think the only coronary arteries you would be asked to identify are the on the left side. There's the left anterior descending or left. What's the name that they officially call it? I think it's anterior interventricular artery. But if you put LAD or left anterior descending down, that is also correct. And then immediately coming off that, the other big artery is the circumflex that wraps around, and then the right coronary artery. And those veins that are associated with it. So a lot of people kept putting the vein for the artery on the anterior for the LAD, but realize that vein is really pretty hard to see in a cadaver specimen. And so I don't think we actually have a good specimen for it there. But that great cardiac vein has frequently been obliterated. And so I wouldn't look very long and hard for it. If there's a clearly defined vessel there, it's probably the LAD. And then similarly on the posterior heart, about the main thing they would be showing might be the right coronary artery coming around to the back, or the coronary sinus, which is probably the best viewed vein in the coronary circulation. I wouldn't be surprised if there wasn't a histologic image of the myocardium in there. And so these would be called myocytes, the myocardial cells. And then they wouldn't have anything on the conduction system on a cadaver. I can't remember if any of the models really show that very well. I think some that open up do probably. So what's this node up here in the atrium?
The blue one?
Right up in here, or number 1 up there.
Is that the SA node?
That's the SA node, sinoatrial node. That's the pacemaker, right? And then it sends an impulse to where? Kind of like the valves, it's in between the atrium and the ventricle. It's called the atrioventricular node, AV node. Okay. And so these basically are nerve conduction pathways that help the impulse, the contraction of the heart, spread symmetrically through the right and left ventricle at the same time. So it splits into this bundle here. There's something that's called the bundle of what? His. And then it splits into a right and left Purkinje fibers that supply the ventricles. And you can end up with a block on either one of those if you have a heart attack. And I think there was a question. I can't remember if it was on one of the quizzes, the Connect quizzes, or or something else that you guys had, but it was asking about if you had an LAD infarct, what would it more likely affect as far as the conduction system goes? So that'd probably be the left or the left bundle branch. So you have bundle branch blocks that will show up on EKG. So you'll probably get into that later. I don't know if they covered that before when you all did EKG stuff, but and I think the rest of this is that kind of stuff. EKG, let's see. Back here, we're just showing ejection, timing of the cardiac cycle, and you shouldn't have any questions on that, I don't believe. Probably have more of that when we study pulse and blood pressure and those kinds of things. So.
Wait, I have a question.
Yep.
How much of like the nervous system in the heart is going to be on the exam? Like how heavily should we study that?
I wouldn't put a lot of time on it. I would just know SA node, AV node, and then there's these bundle branches, Purkinje fibers. And I can't remember that there were a lot of questions. I don't think there were any questions on the quiz about it.
Can you tell us what the point of SA and AV node was again?
Yeah, the SA node is your pacemaker. So it fires at about 70, 72 beats. Let me see, I'm trying to find, here we go. So it fires at about 70 beats a minute. And it's what creates the SA node, is what creates this little P wave here in the EKG. And then there's a pause. So that's pretty important actually. So there's this, when you look back here at this thing, there's not a direct connection between the SA node and the AV node. So it takes time for that impulse to get around and stimulate the AV node, which then it fires. And when it fires, it very quickly sends impulse down into the bundle of His and those Purkinje fibers to cause the ventricles to fire all at once. So that's where you get this QRS complex. And then everything repolarizes right here and creates this T wave. This is a QRS wave and the T wave. Now, if you lose your SA node, like some people probably heard of atrial fibrillation. That's where sometimes people will dilate out their atrium and they stop having a regular heartbeat from the SA node. The atrium just kind of quivers up there and never really contracts. But some of those impulses get through, so the AV node kind of serves as a block to keep too many of those impulses from getting through, but it can cause too rapid of a heart rate at times. But the P wave followed by the QRS followed by a T, and you can see all sorts of different conduction defects or arrhythmias as a result of that. I'll tell you one funny story about this. I had a patient who came in, a young lawyer, he's 48 years old, came in with an inferior wall MI, and he had a right bundle branch block, but he also had what we call a second degree heart block. And so a first degree heart block is where you get a prolongation in this PR interval up here. second degree heart block, you get a prolongation that gets longer and longer and longer until you drop a beat. And then things kind of reset and it picks up and they have another normal beats again that follow the P wave. So P, QRS, and that's called Winky block or Mobitz 2 second degree block. There's another kind of second degree block that can be serious, but we had this kind of unscrupulous cardiologist that I was in charge of the CCU, and so this cardiologist says, well, you better stick a temporary pacemaker in him. I said, you know, it's just Mobitz 2 Winky block. He probably doesn't need it, right? He goes, well, you better just stick one in anyway. This guy would charge for anything he could possibly think of. So you know, so I said, okay. So I stuck it in there, and this poor guy, every time he slowed down and his pacemaker would kick in, the spike on the pacemaker would fire on this T wave, and the myocardium is very unstable at that point, and it would immediately throw him into ventricular fibrillation, which means his heart would stop. So I'd go in and smack him on the chest, which never works, and then we'd have to shock him and bring him back. So that happened once, and I looked at the nurse. I said, "Hey, I told you didn't need this, and he's going to prove it to us." So I turned the threshold down where it would be even longer before the pacemaker kicked in again. Sure enough, like 20 minutes later, he drops his heart rate down again, goes into VFib. Every time they would do this, they'd call a code overhead. It was right there in the CCU. So I just walk in, smack him on the chest again, wouldn't work, shock him, he'd come back. This happened a third time. Finally, I called the cardiologist. I said, I'm disconnecting this pacemaker. I said, he's gone into VFib 3 times, firing on the T wave. He said, okay, well, just leave the wire in. I said, all right. And the patient asked the nurse, he said, should I not go to sleep? And she goes, no, that's okay. Why would you ask? And he goes, well, because he would pass out every time he'd go into VFib, because you've got no circulation to your brain. He said, every time I go to sleep, that big tall doctor comes in and hits me in the chest. She said, no, I won't let him do that anymore. You go ahead and take a nap. I said, golly, this is ridiculous. Anyway, if somebody doesn't need something, they don't need it. Okay. All right. So if you guys know that you're going to do okay on the test. I assure you. But I know you all were disappointed on the quiz, and it was tough to see that. But you all let me know if you've got any more questions, and we'll go over them. And if you think you'd like to do this again tomorrow night, we could do that. I don't know if any of your classmates who weren't able to make it tonight might be able to make it tomorrow night, but I'll set up another one tomorrow night for an hour or so if y'all want. I see some heads nodding. Is that yes? Or? Okay.
I had a question.
Sure.
After the review of the quiz last Wednesday,
Yeah.
You mentioned something about the foramen ovale and fetal circulation.
Yeah.
You told us attention to that. Can you go over that as well?
Sure. I think that's in here. Actually, it's not. Let me see if it's in the. I think I had it in my presentation, but essentially there was it would probably be, if anything, there would be a question about it. let's see, yeah, right here. You see this little thing right there, that little connection between the pulmonary trunk, and that's the ductus arteriosus, or what's left of it. So that's an open vessel in the fetal circulation. So in the fetal circulation, let me see here. In the fetal circulation, you have that, plus you have a what's called a foraminal valley, and it's going to be back in this area here, that connects the left atrium and the right atrium together, so that blood comes in through the superior and inferior vena cava, and part of that blood is mixed with the blood from the umbilical cord that is oxygenated. So it doesn't have to go through the lungs. So it goes straight across into the left atrium and goes out the pulmonary valve and right into the aorta, because it's already oxygenated. And as soon as the baby is born, this foraminal valley, FORMANOVALE, slams shut. So there's a hole there and a little flap on the other side, that when the baby's born, the lungs open up, and that increases blood flow through the lungs, increases pressure back on this side, and puts pressure back against that flap and closes that foraminal valley, and it seals up within a day or so. And then this, over about 2 days, shrinks down and constricts and closes, and just turns into this little remnant of looks like just a little ligament or something between there. But those are open and close quickly right after birth. You wouldn't be asked any of that physiology around that, but you might just ask about those structures. What structures might you find in an adult circulation that are there during fetal circulation, but that go away. So interesting stuff, though. Anything else? I just say work on just knowing a few of the hormones from each gland, what stimulates and targets what, and know the flow of the blood through the heart, just stone cold. You got to know that frontwards and backwards. That's a good way to drill on it. It just go through that in your sleep. Just where it goes, what it passes over, what it goes through, where it comes out, and what everything that it touches is called. If you know that, you're going to have half the questions on this test. Okay. All right. Well, I'll send out another one tomorrow, and we'll do another one at, is this a good time, you think? Maybe make something later, or?
I
This
would
was a
prefer
good time
later.
for me.
What's that?
A bit
I would-
later. I have lab during this time tomorrow.
Oh,
Yeah,
okay. So 6 o'clock, 7 o'clock?
Yeah, 7 or 6 works.
Okay. All right. Well, I'll try to do one at, tell you what, I'll cut the difference. I'll make it 6:30 tomorrow. Okay. Okay. All right. You all have a good night, and study hard. You guys will get this. All right. Y'all have a good night then. And
Thank
I'll
you,
put
doctor.
this, try to I'll try to put this recording out there. I haven't done this yet, but we'll give it a try. All right. See you all.
Thank you, Professor.
You bet.
Thank you, doctor.
Okay, take care.